Come in.
Hi, I'm Sarah Voss. I'm the physician assistant student who's going to be doing your exam today. Before we get started, can I just verify your name and date of birth?
Yeah, it's Rachel Kernan, 6'11", 96.
And I just want to double check that you're right with me doing your exam since I'm still a student.
Yes.
Okay, great. So to start out, I'm just going to take your vitals. And we don't have a thermometer here, but I'm just going to pretend to take your oral temperature and lift your tongue up and put the probe under. Go ahead and close. And open. Okay, great. So your oral temperature was 98.6, which is totally normal. And now I'm going to go ahead and take your pulse. So I would take your pulse for 30 seconds. Okay, so while I was taking your pulse for the 30 seconds, I got a rate of 60 beats per minute, and it was 2+ strength, and it was regular rate and rhythm. And I also was able to count your respirations over another 30 seconds, and I had 12 breaths per minute, and it was normal rate, rhythm, pattern, and average effort. So all that looked good. So now I'm going to go ahead and take your blood pressure. I'm going to start by just taking your pulse so you can just relax your arm. Okay, great. So your pulse stopped right at 120, so that's where I'll be pumping up the cuff to, and you can just go ahead and relax for about 15 seconds. Great. You can relax your arm right on mine. And just make sure your feet are flat on the floor and not cross for me. Thank you. Okay, perfect. So your blood pressure was 100/70, which is right in the normal range. Now we're going to right arm seated. So all that looked good. And now I'm just going to go ahead and ask you a couple questions. Can you tell me your name and where we are?
Yes, Rachel Kernan, and we're in Indianapolis.
And what's the date today?
8/27.
Perfect. So the patient is alert and oriented to person, time, and place. And her mood is appropriate. She's dressed appropriate for the season. She's well nourished. Her hygiene looks great. And her speech is regular and appropriate. So all that looks great, and her affect is also appropriate as well. So now I'm going to go ahead and move into the HENT exam. So to start, I'm going to go ahead and have you cover one eye. And I'm going to go ahead and let me know when you see my fingers in your field of vision.
No. 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 No.
Great. And now cover your other eye.
No. 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 No.
Okay, perfect. Now I'm going to go ahead and check your pupillary reflex. So I'm going to check the direct first. Great, direct. And I'm going to check consensual. Great. So pupils were equally round and reactive on each side. And now I'm going to go ahead and check your extraocular movements. So keep your head still and follow my fingers with just your eyes. So extraocular movements are intact as well as convergence. So all that looked great. Now I'm going to go ahead and check your ears. Should be tip. No, I did. Okay. So I'm just going to take a look first, and ears are symmetric bilaterally. No signs of discharge, lesions, or ecchymoses on either ear. So I'm going to go ahead and take a look inside. Okay, perfect. So tympanic membranes were intact. They were nice pearly gray, and the light reflex was present bilaterally. Jaw looked normal, so now I'm going to go ahead and inspect your nose. And septum is midline intact, no excess discharge, and nares are patent. Now I'm going to go ahead and take a look inside. Sorry. Okay, perfect. So nasal mucosa was nice, pink and moist. Turbinates were visible and intact on each side. There were no lesions, edema, or excess discharge. So now I'm going to go ahead and look in the throat. I'm going to have you open your mouth. And dentition was good. Oral mucosa is pink, non-erythematous, and moist. And now go ahead and say ah. Perfect. And soft palate rose symmetrically. And normally I would do the gag reflex, but I'm not going to today. And go ahead and stick out your tongue for me. So tongue protruded midline, which shows that cranial nerve 12 is intact. So now I'm going to go ahead and do a neck exam. So first, I'm going to listen for carotid bruit. Or first I'm going to inspect in trachea is midline. And I'm going to go ahead and listen for carotid bruits before palpation. Oh, go ahead and take a deep breath in and hold it. Okay, great. Other side. Take a deep breath in and hold it. Okay, perfect. There was no evidence of any carotid bruits. So now I'm going to have you stand for just a second, and I'm going to put my hands on your neck and have you swallow for me. Perfect. So everything moves symmetric. Trachea and esophagus move symmetrically. Was anything tender? Mm-mm. There was no tender, and the neck was of an average size and shape, so that all looked normal. Okay, now I'm going to go ahead and do your lymph node exam. So I'm doing preauricular, postauricular, occipital, submandibular, tonsillar, submental. Then I'm doing superficial cervical and posterior cervical. And then I'm doing supraclavicular. And all nodes, was there any tenderness? No. All nodes were non-palpable on both sides and non-tender. So that looks good. Now I'm going to go ahead and go ahead and listen to your heart. Sorry. Now I'm going to go back through and listen with the bell. So normally I would do this with the patient. Normally I would do this with the patient just skin to skin, but not in this exam. There was heart rate was regular rate and rhythm. No murmurs, gallops, and rubs. S1 and S2 was normal, and there were no extra hard sounds like S3 or S4. So now I'm going to go ahead and listen to your lungs. And can you cross your arms for me? And then go ahead and take a deep breath in and out through your mouth. Okay, perfect. Lungs sounded great. They were, pattern of breathing was normal, average rate, rhythm, pattern, effort. No wheezes, bronchi, or rales were heard on exam. So now I'm going to go ahead and do the abdominal exam. So I'm going to have you lay down. And first I'm just going to inspect, and there are no lesions, scars, abdomen's flat, and so now I'm going to go ahead and listen in all 4 quadrants. And now I'm going to go ahead and listen for abdominal aorta bruits or renal artery bruits. Okay, so bowel sounds all sounded normal, and there was no sign of bruits. So now I'm going to, sorry, I had to palpate still. No. Now I'm going to go ahead and do light palpation in each quadrant. And now I'm doing deep palpation. Okay, perfect. Abdomen was non-tender palpation, which is normal. So now I'm going to go ahead and do the neuro exam, or upper and lower extremity exam. So first I'm just going to look at your extremities. No signs of edema, nice warm temperature, no erythema, no lesions. I'm going to go ahead and check your radial pulses. So they're equal bilaterally, which is normal, and now I'm going to check flexion and extension of your extremities. So go ahead and push against my hands at your wrists, and now the elbows. Perfect, and the shoulders. Good, so 5 out of 5 strength. And now I'm going to go ahead and check cap refill. Good, so cap refill is less than 2 seconds bilaterally. Now I'm going to go ahead and check your lower extremities. And normally I would have the patient just in a gown to get full view, but upon inspection there's no signs of lesions, no signs of edema, temperature is normal, and there's no signs of edema. Okay, so now I'm going to go ahead and check flexion and extension of the lower extremities. This is a bad angle. Okay, so go ahead and push against my pressure. Good. Push. Push. Push and extension, and then we'll do ankles. Perfect. And then I'm going to go ahead and feel for dorsalis pedis. Perfect. And posterior tibial pulses. Perfect. So all that's normal. And now in the neuro exam, I'm going to go ahead and check your reflexes. So first I'm going to start with the biceps tendon reflex. Can you flex for me? Mm-hmm. Okay, perfect. Okay. And now I'm going to do the patellar reflex. I'll do that one more time. Okay, perfect. Okay, so now I'm going to do a couple special neuro tests. So I'm going to have you hop down. And first, I'm going to do the finger to nose test. So I'm going to have you touch your nose and then my finger. Okay, perfect. And now I'm going to have you do the Romberg test. So stand with your feet together and close your eyes. I would do that for 30 seconds. Perfect. I didn't see any signs of swaying or anything like that, so that looks normal. And now I'm going to have you do the pronator drift test. So I'm going to have you put your arms out, palms up, and close your eyes. Feet together. Perfect. And I would have her do that for 30 seconds. And look for her arms start to pronate. Okay, perfect. And now I'm going to have you walk across the room, going heel to toe. Okay, perfect. And now I'm going to do a couple more tests. So I'll have you sit up here, and I will start with light touch for cranial nerve 5. So go ahead and close your eyes and let me know when you feel a light touch.
Now. Now. Now.
Perfect.
Now. Now. Now.
Perfect. Now I'm going to go ahead and test cranial nerve 7. So smile, frown, grimace, and then can you puff out your cheeks? Perfect. And then close. I'll have you open your eyes. Try to close them against my resistance. There you go. Perfect. And then raise your eyebrows. Okay, perfect. Now I'm going to do cranial nerve 8 testing. So I'm going to have you close your eyes and then raise your hand on the side that you hear my fingers. Perfect. That'll look good. And now I'm going to test for cranial nerve 11. So just lean your head into my hand. Perfect. Then shoulders. Perfect. And then we would do the GU exam in a real patient situation. That's all.